I'm here today to spend a little time to let the politicians and the leaders of this country know that we care about this issue. We're not going to let them slide this huge, expensive bill and make it become law.
We did want to come here because we are greatly encouraged about what we have seen Congressman McIntyre say in your paper and others about his, very sincere concerns about this legislation. We know he's being lobbied hard by the very hard left in the country, and he seems to have a good sense of what the people in his district want, and they don't want a government takeover of health care. And so we're here to try to make sure that people who feel like we feel are contacting him and contacting Senator Hagan, expressing concerns about this bill, expressing severe concerns about the public option, and of course, fundamentally, we don't believe we can afford any kind of tax increase here in this recession, in this economy. That would just be devastating. So we have to hold the line on taxes. So.
Thank you. No, but I'm sure you hear his perspective.
We need to keep the government off of our health care. We do not need the government making decisions about who gets what kind of care. We do need to increase competition among the insurance companies, allow individuals to buy insurance across state lines. We need to cut out fraud and abuse in the system. We certainly need tort reform. Anything that's called major overhaul of our health care should include tort reform. And the current proposals have nothing to say about tort reform.
Americans for Prosperity. Anybody heard of Americans for Prosperity out here? Okay, good. I hope after today that more of you will be a part of our group. We are a nonpartisan, nonprofit group dedicated to the principles of limited government and free market entrepreneurship. And that's why we're here with some concerns about the health care legislation that is now being debated in Congress. We at Americans for Prosperity, again, we're nonpartisan, nonprofit, but we're a grassroots group.
We have a Congress that hasn't even read it. Common sense says you can't go buy something when you don't have money. We keep spending money, spending money. It does need to be changed, but why not just take an approach like we do it, like you do on your personal stuff? You don't just go out and spend a whole bunch of money changing something overnight.
To help us, drive a knife in this horrible piece of legislation that is up there in the House of Representatives. That they're going to tax tonight to pay for this bill. And if you didn't get that message, when you go shave or brush your teeth tonight, look up in the mirror. Because the rich they're talking about is you. We cannot, in this country, create a big government entitlement program that rivals the scope and expense of Medicare or Social Security and expect that 1 or 2% of the population are going to pay for that. America have soundly rejected over the month of August. What we've seen in the month of August across this country in places like Lumberton and Laurinburg, we were there yesterday with about 150 people out in a parking lot, and we've seen it all over America, is people do not want government bureaucrats in their exam rooms with their doctors. They really don't. And they don't believe the same government that can't get water to thirsty people in hurricanes, can't manage the Cash for Clunker program, is capable of managing something on the scope and size and complexity of the U.S. healthcare system. We are not Europeans. We are not Canadians, and we are not socialists. And at the end of the day, we need to protect what we have left of a free market healthcare system.
When the president took over, the country was in pretty bad straits economically. Unemployment was way up. People were worried about gas prices. People were worried if they were going to have a job. They were also worried if they had a job, if they could get there, afford to pay for the gas to get there. So the country was looking to the president to see what he was going to say. And when he took his inaugural address, they were interested in what kind of vision he was going to lay out for the country. The president looked Americans in the eye and he said, in this time of crisis, government is not the solution to the problem. Government is the problem. Now, you know, I'm not talking about the current president, but I'm talking about Ronald Reagan when he was faced with the same kind of crisis. But how many wish that the current president would have taken that same approach?
I was asked this morning, why am I so concerned about the healthcare situation? And the most important reason is because I'm a doctor, my wife's a nurse, we've experienced the healthcare, but also we have 5 children at home, and I don't want their futures to be bankrupt. I think we need to stop spending until we control the deficit that we have, and then we can go forward. Clearly, healthcare needs some reform. I'll be the first one to admit that. But I'm unusual from this situation that I have worked and lived overseas in countries that have government-controlled health care. I did part of my medical training in England. I later lived in China, and I've seen terrible things happen in the healthcare situation.
All ugly. But I want to say there are some things that we can be talking about and doing right now. That we do not need a 1,000+ page omnibus bill with everything thrown into it in the kitchen sink and saying, this is your reform, take it or leave it. And we should be breaking these things out and debating them one by one, because this is too important. But there are several things that I would like to put forward as patients first solutions, free market solutions that we can be talking about right now. And Dallas mentioned one of them right off the bat, which is allowing people to purchase insurance across state lines. That would increase competition in the healthcare industry by a tremendous amount. I mean, you think about it, 50 states as opposed to 1.
I'm here today to spend a little time to let the politicians and the leaders of this country know that we care about this issue. We're not going to let them slide this huge, expensive bill and make it become law.
Dallas,
Thank you.
We'd like to thank you for coming to Robinson County today, showing your support.
Right.
Do you have any last words?
Well, I think, look, Robinson County can be key in this battle. We have got to get McIntyre, who's close to being on our side, all the way in. We've got to get people from Robinson County, calling Kay Hagan, and you know, Robinson County can make a huge difference in this act.
Dallas, we appreciate you coming
Thank
to
you so
Robinson.
much.
Thank you, Dallas
Appreciate it.
Woodhouse, Americans for Prosperity.
Thank you.
Thank you.